Hello, I'm Matthew Weinstock with Hospitals and Health Networks. In 2011, the Department of Health and Human Services issued $218 million in grants to 26 hospital engagement networks. The so-called HENs were charged with achieving some pretty ambitious patient safety goals, reducing patient harm by 40% and readmissions by 20% over 2 years. The American Hospital Association's Research and Educational Trust operated the largest HEN, partnering with 31 hospital associations and more than 1,500 hospitals. During the past 2 years, the HRET HEN achieved some significant milestones, including preventing patient harm to nearly 70,000 patients and saving the healthcare system more than $200 million. That work will continue through 2014, but some major challenges lie ahead, including improving data reporting and pushing the field closer to those overall patient safety goals. I'm joined right now by HRET's Malik Joshi and Charisse Colum to talk about the HEN's achievements and path forward. Malik, Charisse, thanks for being with me today. So can you guys talk a little bit about the achievements you saw through the HEN over the past couple of years? As I said, you hit some significant milestones. What would you say were the highlights?
So part of what we have said related to the HENs is really getting the frontline staff engaged as well as leadership and physicians. So that has really helped us with achieving the milestones that we have achieved during the last 2 years. We certainly look forward to continuing the milestone achievement, as you mentioned, in 2014. But we've really worked with our fellows in our fellowship program, our physicians, our CEOs, and our frontline staff to really embark on this journey for the Hospital Engagement Network.
In terms of hitting those 40-20 marks, though, were there some areas that you achieved those marks and some areas where you didn't, I imagine, right?
Yeah, adding to Charisse's comment about the engagement, which is such an important element, overall, there are 69,000 patients that had harm prevented as a result of our different topics, which would equate to over $200 million of cost savings coming out of the healthcare system. So overall, they've hit that mark. We've done that very well. Our hospitals have done that very well in areas like reducing early elective deliveries and reducing central line associated bloodstream infections, surgical site infections, and readmissions. But there are topics which is harder. It's been harder to get to the big goals that we are striving for. Topics like patient falls with injuries and pressure ulcers are ones where it's been movement, but not to the pace that we all want to see.
And what do you think causes that, the challenges in patient falls or something like that? Why are those harder to get to?
Those topics are complicated systems. So reducing central line associated bloodstream infections, they're more captured, contained in an ICU or a microsystem. Patient falls, pressure ulcers, readmissions cut across many departments, many individuals, even organizations. And so I think it is, as Charisse said, working across our network to really learn how we do that. So improvement is happening, but it takes a little bit more effort to get the connections going.
So if we can talk a little bit more about sharing of best practices across the field. As you know, we did in 2013 that video series in HN Daily about the HEN. And one of the things that came across in so many of those stories was sharing best practices. So talk a little bit about how your HEN has done that. I know you have a listserv, you've done some in-face meetings, you've done some virtual meetings. What strategies work the best?
So we really feel the face-to-face meetings helped with the networking and getting the frontline staff to really connect with other frontline staff at those meetings. We feel the webinars that we host with showcasing best practice in case study hospitals has really helped provide these hospitals with thoughts and ideas and strategies to help reduce their harm. And the listservs have really come into their own over the course of the project, where people are free to ask any question at all related to the topic that they are subscribed to. And hospitals are very willing to share their protocols, share their experience, share their policies, their tools. And the last thing I would add too is our website is also a huge resource-intensive, one-stop shopping place for them to go and get their change packages, their checklists, articles, and anything else that they need to reduce harm and reduce the readmissions for the HEN.
Can you talk a little bit about what you're seeing in terms of board activity and the C-suite activity.
We know governance engagement in eliminating or preventing patient harm is critical, and that's what this is about, preventing patient harm. So we are developing another curriculum for governance, for boards, around how do you engage your trustees in this topic, how do you measure and track patient harm, which is a new way of really aggregating all the different harms we're seeing in the Partnership for Patients campaign into one metric that we know is meaningful and that we can move. How do you engage your clinicians in this work, and how do you engage your patients and family members in this whole strategy? So that series will be coming out in the beginning of 2014 through Trustee Magazine, and again, another way to share how we can learn and engage the boards in this effort.
So Malik, that really gets that idea of sustaining this effort across the HEN and to those hospitals that aren't a part of the HEN. So as you look at 2014 and beyond, what are some of the approaches you think you need to take to sustain this, build it, and keep it growing?
So really with our fellowship program, we see that those frontline workers who have been educated in our fellowship throughout the last 2 years and then going into 2014 will really be the keys to sustaining and spreading their knowledge to other frontline workers, as well as to other topics that may be needed within their hospital. The other component that we are launching in 2014 is our PMG through AHA HRET, the Society for Leaders in Healthcare Quality, and we really feel that that will be another vehicle to provide education, resources, networking to sustain this momentum through even past the HEN.
So that's a personal membership group within the American Hospital Association, so you'll be able to spread the HEN knowledge to hospitals that perhaps aren't a part of the HEN through that group, right?
Absolutely. You know, and this is all due respect to all the HENs. We've been working well with our state hospital associations and our hospitals to spread and implement. But it's the improvement leaders that are making the work happen every day in our hospitals. The over 1,200 improvement leader fellows that we've had through the HEN, we now have this cadre, a network of leaders. So we're really going to build upon that success. And this new personal membership group, I think, will facilitate that acceleration of learning amongst them.
Put the HEN in context for me of the debate we're having nationally in terms of healthcare delivery system transformation. So the move to value and all those issues that are going on at the federal level.
You know, at the federal level, these are all connected. I think one of our jobs in working with our hospitals is sense making. So these are all connected efforts. Value-based purchasing, the readmissions penalties, meaningful use, pay for performance, they're all connected to improving quality and improving efficiency. And the HEN allows us to do that. So the HEN is really a jumpstart to all these programs that are out there. So if you're improving on readmissions, if you're improving on reducing patient harm, you're doing well in value-based purchasing. Your meaningful use is an important part of that. So they are all connected. So it's really, to us, it's alignment more than a debate. We talk often about harmonization. The HEN is harmonized with all the federal programs in terms of, again, improving quality for our patients and improving efficiency.
Well, great. Charisse and Malik, I appreciate your time today.
Thank you.
Thank you, Matthew.
And I'm Matthew Weinstock for HN. Thanks for tuning in.
Thanks for tuning in to HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.